Hello everyone, again I'm Gladys at the Nurse to Follow, and welcome to this new session. If you haven't watched my previous video yet, I advise you start off from there because this is actually a follow-up video from the previous one. So if you're new to this channel, please do not forget to hit on that subscribe button. Do not forget to like, comment and share if possible. Again, it's all about sharing some key subject areas for the NCLEX PN board exam. And before we get started, welcome back guys. Before we begin, I would like to add that NCLEX actually had planned to change their exam settings. So it's not actually very different from the old setting. I was fortunate to take part in one of their surveys. If actually they have implemented this new setting, so they'll give you scenarios that are a little bit more lengthy, and they'll have a series of questions that follow from this scenario. So one scenario may have about 6 questions or 7 questions or 5 questions to answer from that one scenario. So they'll give you a whole lengthy scenario, a series of vitals and lab results and signs and symptoms and complaints from the patient. So it's a whole lengthy scenario, and you have questions that follow from that scenario. So all the questions will be based on whatever the scenario says. Okay, so it's like answering a kind of composition question. Okay, so that we have to do a lot with your critical thinking to answer this kind of questions. For example, they may give you a case scenario with different vitals, and they'll just ask you a question like, from the complaints given by the patient, what do you think this patient is suffering from? And they'll give you a list of options for you to choose. And they may also ask, from the lab results received, what will be the best intervention? And they'll give you, so you get about 6 questions from just one scenario. So that's basically the difference, but the idea remains the same. That was the side I thought you should know. So back to our key subject areas. I'll begin with prioritization. So prioritization questions are very important. You get a lot of them, and they carry a lot of points too. You need to be a good critical thinker to get your prioritization questions without stress. I'll say prioritization questions are actually one of the most difficult. Yeah, and to be a pro in answering prioritization questions, it requires a lot of practice. So I advise that you find time to practice a lot of these questions. Yeah, you have to find time to answer a lot of prioritization questions. That way it helps to be your critical thinking. And there are tricks that can help you, to better your understanding with prioritization questions. For example, you should focus on the key areas. They may give you a whole scenario. You should learn to focus on the key areas, learn to eliminate what you do not need from that scenario, because they'll actually be some of them are so lengthy. Some of these scenarios will be so lengthy. You have to eliminate what you don't need. Some of them are just mere distractions. You have to focus on the key areas and eliminate all informations that you do not need. For example, you may get a prioritization question like this. An elderly client visited the geriatric screening clinic and complained of pain on his left calf. Then you, the nurse, you also notice a reddening area on his right calf that was warm to touch, and you suspect that it could be thrombophlebitis. So then they may ask, what is the most important additional assessment that the nurse should perform? So you should underline most. Believe me, the options will all look very correct because they just want you to choose the most relevant. Not that the rest are not correct, but you have to choose the most relevant. So that's the trick with prioritization questions, because almost all the options will appear correct. So for this question, they may say A, check the patient's vitals. Of course, it's very important to check the patient's vitals. B, they may say auscultate for long sounds. Definitely very important. C, they may say measure the calf circumference. Measure the calf circumference. That is also very important. And D, they may say none of the above. So what do you think is the best option? All these are mentioned as so important. This patient may be suffering from deep vein thrombosis. Now you should think, what could be the possible complications for deep vein thrombosis? PE, pulmonary embolism. Once this patient has deep vein thrombosis, the patient is at risk for developing an emboli which could travel to the lung and cause pulmonary embolism. Okay, so that should be ringing in your mind, and you want to roll this out. You want to make sure this patient does not have PE. And what is the best way to roll this out? By auscultating the lung. So that is the best option for this case scenario. You see, so if you're not a critical thinker, you will not arrive to this, to this answer. So the next subject area is management and delegation of tasks. So for management, you mostly get questions like problem resolution and time management. So the kind of problem resolution questions you get are, for example, they may tell you, you ask an assistive personnel to take lab samples to the lab, a patient's lab samples to the lab, and the assistive personnel tells you, oh, I'm busy, I can't take them right now. So what would be the best response by the nurse? And you'll see options like insist that the assistive personnel takes the lab samples to the lab and leave what she's doing. Another option may say take the lab sample to the lab yourself. Another option may say report to the supervisor. So remember, your priority is the patient. Still on problem resolution, you may also get a question like, a physician was yelling at a nurse in the hallway to the hearing of patients and other co-workers. So what would be the best response by the nurse? And you will get options like ask the physician to stop yelling at you and speak in a better tone, or they will give you some crazy options. So the best option for a question like this is to tell the physician, can we move to a private corner so we can discuss this? So that would be the best option for such scenario. I guess we've come to the end of this section. If you didn't watch my previous video, I still advise again that you follow up from there. If you have any doubt regarding these subject areas, do not forget to leave your comments in the comment section below, and I promise to get to them as soon as possible. Okay, so stay blessed and stay safe.